Hi there, my name is Samantha Boyer. I am here today to talk to you about rheumatoid arthritis. There's a difference between having arthritis and having rheumatoid arthritis. Rheumatoid arthritis is very different than osteoarthritis. Osteoarthritis actually affects the joints and the cartilage and the bones in time from just normal wear and tear. Rheumatoid arthritis is a autoimmune disease. It attacks the body's joints. It's awful. You can have multiple symptoms. The reason why I have such an interest in this is because my mother is a longtime survivor of rheumatoid arthritis. She's had symptoms for as far back as I can remember. When I was younger, I just remember her taking medication all the time, trying to maintain her pain, and didn't really know what the situation was. Unfortunately for her, she had been misdiagnosed multiple times. She had gone through multiple different treatment options, and none of those worked for her. My mother was falsely diagnosed with fibromyalgia and chronic pain, and they didn't really know what to do with her. She's fought this battle of people thinking that she's just seeking drugs, but the traditional medications for rheumatoid arthritis treatment didn't work for her. When she was a child, she was exposed to hepatitis A, and they learned after many people got sick who had had hepatitis in their past that hepatitis it has an interference when it is introduced to the medications that they use to traditionally treat rheumatoid arthritis, such as Remicade and Neurontin and methotrexate. When my mother went through those treatments, she ended up getting a horrible bone infection called osteomyelitis, and she lost a good portion of her jaw and had to be on a PICC line to save her life. She now has to do nothing but manage her pain. But I would encourage you to talk to those that you love if you have symptoms of arthritis and look into the other treatment options that are available. They have lots of different treatment options such as acupuncture and massage therapy. Unfortunately, these things, as they progress, lead to more expensive treatments like knee surgeries and hip replacements, which can run anywhere from $15,000 to $60,000. That's a big cost. They make you go through a lot of different treatments before you get to the surgery process and also before you get to the chronic pain management process. All of these things are very difficult and very frustrating. But I'd like to explain a little bit more about how rheumatoid arthritis affects you. See, your body has an inflammatory response. It's your body's job to find invaders and to attack them. It does a great job at it. That's why we all live and survive and thrive, because our bodies know how to handle attackers. Unfortunately, we have an antibody in our system called IgG. IgG is wonderful. It catches all kinds of horrible problems that enter our body. But sometimes IgG attaches to foreign invaders and it gets missed. The macrophages in the body don't find it because it's very, very small. And so they end up getting missed, and then they attach to the joints. And eventually they're found. So when the body's phagocytosis process starts and it goes to attack what the antibody has attached itself to, it falsely attaches to the joints and it starts to eat away at the cartilage and it starts to deteriorate and it doesn't know when to stop. So there's new treatments also, besides medications, that can help in this, like the pheresis procedure that will actually remove the antibodies from the blood and make it a little bit more easy for the body to start to heal. Although most of the damage that's done by rheumatoid arthritis is not something that's reversible. So it's more of a let's try not to create more damage than it is about fixing it. You can fix it with the surgeries to a certain extent, but a lot of those surgeries are also not extremely effective for people with rheumatoid arthritis because once the damage has started, it's kind of hard to fix it and go backwards. All of these things are very frustrating in the field that I'm looking into going into. In addition to that, we have a lot of problems with insurance. So they make you go through quite a process, and patient care seems to be a little less important than the paperwork trail, which is very frustrating. I don't completely understand it, and I look to enlighten myself further as I go forward and try to find ways to fix this. This is one of many horrible diseases that we can do things to make people's lives better, make them feel more comfortable, and we shouldn't have to go to the extreme measure of palliative care immediately when people aren't necessarily being diagnosed with a terminal illness. Rheumatoid arthritis is not a terminal illness. It's not considered to be a terminal illness, although it can lead to death. It can lead to earlier death, and it can certainly lead to an uncomfortable life, which is very frustrating. There are DMARDs. Those are medications that do work for rheumatoid arthritis, but a lot of time it takes more time than what people want to see when they're seeking treatment and they're seeking to feel better. There are biological drugs that can offer immediate relief, but they weaken the immune system. And as I've already explained, we don't want to do that. We don't want to weaken the immune system anymore. It's already a little confused and kind of it's kind of reacting in an inappropriate fashion, if you will. There are other things too that you can do once you find out that you have rheumatoid arthritis. Although it's easier said than done, exercise is definitely very beneficial to helping your body work the way that it's supposed to, but it's hard to exercise when you're in a lot of pain. Ice and heat can help as well, and massage therapy is also very good. Physical therapy is also another option that's very, very good. Ultimately, the knowledge that a person obtains about rheumatoid arthritis improves the likelihood that that person will be more successful in dealing with the disease and early diagnosis as well. If these things and techniques and treatments are applied at early onset of the disease, then quality of life is improved vastly. Beyond that, proper early diagnosis of RA can prevent early death. I encourage anyone with arthritis or signs or symptoms to get checked out immediately. Do it for yourself and do it for someone that you love. Thank you so much for taking the time to listen. I hope that this has informed you a bit, and I hope that you have a great day. Thank you.